With the world today facing this deadly virus called coronavirus that has caused thousands of deaths and millions of people infected around the world, scientists believe that tomorrow the world is going to face a threat called drug resistance. Welcome to this video. My topic today is drug resistance. The emergence of the drug resistance was first reported in a major disease such as HIV, TB, and diarrhea in 1990s. What is drug resistance? Drug resistance is the reduction in the effectiveness of the drugs. That means the drugs that yesterday was working is no more working. Or the drug that yesterday was efficient is no more efficient. And that term is used to refer to a cancer or a pathogen that has developed resistance against a drug or a medicine. We know that drugs or medicine has a specific target to which they bind in order to act. But when that target has been altered or modified, the drugs become ineffective. And we also know that there are some bacteria that can change or that can alter the target site, or also they can change the bacteria. Hence, it's going to result also in drug resistance. Scientists have tried to study the mechanism to which the drug resistance happens. And they say the first step is inactivation of the drug. What's happened there? The drug that was yesterday acting, that was yesterday working, is no more working. The second mechanism, the second step to which drug resistance happens is the alteration on the target site. As I said previously, that drugs have a specific site to which they bind in order to act. But when that site is altered, when the target site is modified, the drug cannot bind to a bacteria or a cancer cell to act on it because the target site has been altered. Hence, it is going also to result in drug resistance. The third step, they said that the metabolic pathway can be altered. This means when the metabolic pathway is altered, the composition and the outcome, the chemical outcome is going to be changed. And when the chemical outcome is changed, the drug can no more recognize a specific cell and act on it. Hence, it is going also to result in drug resistance. And the fourth step, they said, there will be a reduction in a drug accumulation. The drug that was yesterday taken in a large amount by cells is no more taken in a large amount, but it is taken in a less amount. And when a drug is taken in a less amount, it cannot be efficient. It cannot be effective against a disease. This is the challenge today. But scientists have been striving hard to find a treatment to all this cause or to all this threat. And they came out with two treatments. The first one, on a molecular level, we know that the genes ABCB1 encode for MDL1, and which is a P glycoprotein, and these genes transport the medication on a cellular level. And scientists say when ABCB1 is overexpressed, the drug resistance increases. And to remediate to that, scientists has proposed that this gene has to be monitored, and also another drug has to be given. And another issue is antibiotic drug resistance. And a common example that we all know is TB, tuberculosis, which is a lung disease. And that disease is proven to be drug resistant to so many drugs, as we call it a multi-drug resistance. And to resolve to that, scientists had said that the phage therapy has to be used. What is phage therapy? In this phage therapy, we use a bacteriophage. A bacteriophage is nothing than a virus which can kill a bacteria. And that virus is going to act on that bacteria in order to kill the bacteria and heal the disease. But there are so many research still going on in order to understand and to try to come up with a lot of solution about this drug disease. As we said, it is better to take prevention than to heal. Today, we have to take prevention. When a doctor gives a course of medicine, we have to try to follow that, lead the hand of the course, and not hand the medicine 3 days after or 4 days after. Or stop the medicine when we are okay. But we have to take that medicine to the hand of the course in order to avoid that drug resistance. That's all for today. Thank you so much.